Radiesse, very big lumps in chin area. Hello, I got radiesse in my chin 13 months ago. I have very big lumps. I can feel them all the time. It bothers me so much and looks so ugly. I want to get rid of them no matter what, even surgery, as long as I look like myself again. Please help me. Any suggestions?
Thank you for your question. You submitted 2 photos and you state in your question that you received Radiesse injections in the chin approximately 13 months prior, and you're describing the awareness of lumps in your chin from that time forward, although you're not specific about the duration and any changes along the way. And you're asking about what your options are, including surgery. Well, I can certainly give you my perspective on how I evaluate people like yourself who come to my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I use Radiesse as well as the hyaluronic acid fillers in the Juvederm and Restylane family, as well as natural fillers derived from platelet-rich plasma, PRP. And so I have a lot of experience with this in this area. Plus, I have dealt with a lot of complications of fillers. People have come here from all over the world for me to manage a few unique issues, including problems related to fillers that created inflammation and scarring, as well as fillers that became lumpy and irregular. So I'm going to kind of guide you a little bit on my evaluation of someone like yourself. So to begin with, I would first ask if this irregularity or this elevation was present from the time that you had the injectable placement. Now there's a basis for this. Very often when people get injectables, initially the injectables feel lumpy and irregular. And often with just facial movement and sometimes with massage, they soften and they blend. Now, that being said, what I would be first and foremost concerned about is whether or not you're dealing with a situation where the material was more well integrated or may have been slightly lumpy in the beginning, and this area has become more lumpy over time or become more swollen. So my first thought is to first eliminate the possibility of a low-grade infection, which is referred to as a biofilm. Now, a biofilm is something that's becoming more and more common as the popularity of fillers grows. And what a biofilm essentially is a low-grade infection, typically from the skin. Literally, the bacteria lives on the material and hibernates in a way that creates what is often described in other areas of the body, such as in breast augmentation or in facial implant, a capsule. And that capsule becomes hardened. And it takes a lot of work in order to address this type of issue. So I wouldn't say that necessarily that you need that this is a biofilm, but it is something to consider. Other things to be aware of is, of course, if the material becomes just a nodule or just doesn't go away, it could be a capsule formed around it that's not a biofilm, and it might be worthwhile considering excision. However, in this area, excision can be potentially disfiguring. So you are looking at some more evaluations that require a one-on-one consultation in order to really determine what the issue is. In our practice, we have helped a lot of people in a lot of different ways, not specifically just with Radiesse, but also with hyaluronic acid fillers. In some situations, these fillers did need to be removed. And in other situations, they were managed as biofilms through the application of a combination of material to dissolve, as well as the use of antibiotics and continuous monitoring. This is not something that you just jump into and do something. You really need to get some opinions if this particular issue has gone from stable to okay to have gotten to be a situation where it's nodular and inflamed. Again, this is not readily apparent from just the question and the photo. But what I wanted to make sure is that you at least learn about this as a possibility. I would recommend that you contact the physician or the provider who did the original injections to learn about what specifically the material was. You may want to connect that with a particular and ask if there was any other people who had similar reactions. This is not necessarily just the things I mentioned. There could be something with the material from the batch of the injectables that were provided. There are more than a few possibilities, and then the simplest is that it may be just that it's irregular distribution of this material. I do want to give you a little bit of understanding of what Radiesse is. Radiesse is a combination of a gel vehicle with a material called calcium hydroxyapatite. Calcium hydroxyapatite is a fine powder that is similar to what makes a bone. And in general, its benefit is that it is a longer lasting filler. The challenge is that it might stay in your body longer than you would want it to. So that being said, there are some possibilities of how to manage, and it does require proper examination in order to make the right determination. So find a doctor with experience with these types of filler problems or issues if the first doctor isn't able to assist you. Of course, ideally you want to go back to the original doctor and at least figure out if there is something they can do to help you overcome this issue. I'm assuming you went back prior to the 13 months, but again, that wasn't elaborated in your question. So I hope that was helpful. I wish you the best of luck. And thank you for your question.